Greetings, everyone. Thank you for being here and for the work you do each day as preceptors. My name is Dr. Melinda Contreras, and I'm the Director of Practice Programs here at Larkin University, College of Pharmacy. Today, we will explore the art of mentoring and, more importantly, your role in shaping not just competent learners, but competent, ethical, and thoughtful future pharmacists. Let's begin. By the end of the session, you will be able to differ between supervising and mentoring in experiential education. Explain how psychological safety and encouragement influence learner development. Apply structured feedback strategies, such as the sandwich method. Identify and reinforce excellence in clinical learners. And implement strategies to build progressive autonomy while maintaining patient safety. This session is designed to be practical, reflective, and immediately applicable to your precepting. We begin with identity. Mentoring in experiential education is not simply a task. It is a professional responsibility that shapes the future of our profession. Precepting is not just about overseeing tasks. It is about shaping identity. And students learn through guided participation in real clinical environments. They observe how you think, communicate, and make decisions. Your role modeling influences both their clinical behaviors and professional values. Feedback becomes the mechanism through which standards are reinforced. And progressive autonomy allows students to build both competence and confidence. In many ways, you are not just teaching pharmacy, you are shaping pharmacists. Understanding learners. To mentor effectively, we must first understand how learners develop. Learners vary widely in confidence, competence, and readiness. Motivation increases with three elements, and motivation increases when three elements are supported: autonomy, competence, and belonging. Timely feedback strengthens both learning and clinical reasoning. And as responsibility increases, so does professional identity. Ultimately, growth is not accidental. It is structured, supported, and intentional. Psychological safety is foundational. Students must feel safe to ask questions and admit uncertainty. When fear is present, fear of embarrassment or fear of criticism, learning is inhibited. Respectful dialogue encourages critical thinking. Mistakes become opportunities, not failures. And importantly, you, as the preceptor, set the tone for that environment. High standards plus high support, identifying and encouraging excellence. Effective mentoring requires balance. Excellence requires accountability. Growth requires psychological safety. If we correct without encouragement, then students stop taking risks. If we encourage without standards, rigor declines. The most effective preceptors provide both simultaneously. The power of encouragement. Encouragement is not optional, it is strategic. Confidence directly influences clinical decision-making. Specific praise reinforces effective behaviors. Encouragement builds persistence, especially after failure. And importantly, high standards and support are not opposites, they are partners. The impact of preceptor language. Language matters. Words have power. So phrases like, that's wrong, or you should know this, can shut down learning. Whereas, walk me through your thinking, or what led you to that conclusion, invite reasoning and reflection. Your words shape how students think and how they see themselves. Excellence in learners is not accidental, it is observable. You will see it when students demonstrate organized clinical reasoning, verify information without making recommendations, communicate clearly and professionally, anticipate safety concerns, go beyond minimum expectations, and respond constructively to feedback. Our role is not only to identify excellence, but to name it. Recognition must be intentional. We do this by naming the behavior, explaining why it matters, connecting it to expectations, encouraging repetition, and reinforcing effort. This transforms a moment of praise into a moment of growth. The sandwich method provides structure. Start with a genuine strength. Address one clear area for improvement. Provide actionable guidance and end with forward-thinking encouragement. This approach maintains dignity while promoting growth. Building autonomy. Now we shift to autonomy. Our goal is to develop independent thinkers without compromising patient safety. What is clinical autonomy? Autonomy is not independence without oversight. It is graduated responsibility. As competence increases, supervision decreases, but accountability remains constant, and patient safety is never negotiable. Students progress through 4 stages. Observe, understanding workflow and reasoning. Practice, applying knowledge with guidance. Perform, presenting recommendations with oversight. Lead, functioning near entry-level readiness. Your role is to guide them through each stage intentionally. You can build autonomy by asking students to verbalize reasoning, requiring evidence-based support, gradually reducing prompts, assigning increasing responsibility, and debriefing decisions. Autonomy develops through structure, not assumption. Autonomy must be balanced with safety. Verify recommendations before implementation. Intervene early when needed. Normalize asking questions. Set clear boundaries and document progress. This balance protects both the patient and the learner. Autonomy is not something students are given, it is something they are prepared for. Now let's apply these principles. We will examine how preceptor language influences confidence, competence, and clinical growth. So here is case study 1. In this case, an IPI student presents an incomplete medication history. An ineffective response might be, you need to be more thorough. The impact? Embarrassment. No clear strategy. Decreased confidence. A mentoring response might sound like, you organize that well. Let's strengthen one area. Or what questions can help you uncover OTC use? Or this is a common learning point. Let's refine it together. The result? Clarity, confidence, and growth. Here's case study 2. An API student makes a recommendation without reviewing full data. An ineffective response. That's not safe. You should know better. This creates defensiveness and fear. A mentoring response. Walk me through your reasoning. What trends did you consider? Your thinking is reasonable. Let's add one more safety check. This maintains standards while building autonomy. As preceptors, you shape how students think. You influence how they communicate. You collaborate confidence to competence. You calibrate. You calibrate confidence to competence. You determine how autonomy is earned. You protect patient care. And ultimately, most importantly, you change lives. Thank you for all that you do. We appreciate you. If you would like to continue the conversation, please reach out to me. I will include my contact information and our department's contact information at the end of this presentation. But I just want to thank you for everything. There's my contact information and how to reach our department. Thank you again.